In tonight's Health Alert, monkeypox cases continue to spread, with 131 confirmed cases and 106 suspected cases in 19 countries. Despite the rise in numbers, the outbreak of monkeypox is containable, and that's according to the World Health Organization. Our health expert, we're going to bring in Chief Medical Editor Dr. Nandi. Dr. Nandi, good to see you in. Did the World Health Organization say if they expect cases will level off or even possibly decline?
So Glenda, the World Health Organization does not know if the spike in cases was, quote unquote, the tip of the iceberg, or if cases have already peaked. Now, health experts believe that most of the cases were spread through sexual contact, with many of the cases in the United Kingdom and Europe found in gay or bisexual men. Now, monkeypox is not considered, remember I told you that before, not considered a sexually transmitted disease, but it can spread through close contact. People can get infected through contact with skin lesions or bodily fluids or infected animals or humans. It can also be contracted by respiratory droplets or by touching contaminated materials. So thus far, most of the reported infections have not been severe, which is great. Symptoms typically include fever, muscle aches, headaches, and lesions or a bumpy rash. These often clear up within 2 to 4 weeks. However, CDC reports that monkeypox is fatal in as many as 1 to 11% of people who become infected. So it's serious, and we got to take a look at it.
So the monkeypox virus hasn't mutated, therefore it's not expected to spread like COVID. And how is this virus containable?
That's important. I understand the concern, and I'm getting the same questions from patients because it's quite unusual, right, to have this many cases of monkeypox spread so quickly outside of Africa. In Africa, the virus is endemic, so cases there are really not that unusual. But according to health officials, a mutation is most likely not behind this outbreak. Also, health experts are not expecting monkeypox to spread like COVID. Very important. It's not as contagious and does not spread like Omicron. So what might be behind this outbreak, people say, right? So most likely it's human behavior. This could mean that this outbreak could be contained with early intervention, and that includes contact tracing, isolation for those who are infected, and really targeted vaccinations. What's important to remember is this, that transmission can happen through close contact, and the virus can enter through broken skin and the respiratory tract. As of now, monkeypox is still considered a rare infection, and there's not a huge risk that the general public at this point in time. But we'll keep on top of this. But I would not panic, but just be vigilant for the symptoms we talked about. If you have any questions, just contact your doctor.
All right, Dr. Nandi, thank you for the update.
My pleasure.